afternoon, everyone, and welcome to Managing Joint Pain from Home. I am Dr. Joel Press, and I am the Chief of Physiatry at the Hospital for Special Surgery. In today's webinar, we're going to talk about joint health and options that we have to manage joint pain from home. Our guests today are Dr. George Cyril and Erica Fritz Iannucci. Dr. Cyril is an attending physiatrist, and Erica Fritz Iannucci is a physical therapist and manager of Orthopedic Physical Therapy Center at the Hospital for Special Surgery. Great to have you both with us here today, and I hope that we have plenty of information to share with all of our audience today. So let's get started today. George, I want to start with you. Obviously, everybody is at home a lot now, and the quarantine, the stay-home orders over the last few months kind of changed the way that we've all done a lot of things. It's not like staying home like we used to. We're actually all working from home a lot more than we used to. And what are kind of one or two of the primary issues that you're seeing in your practice now that's related to this? And really, how is that different than it used to be before COVID?
So I would say post-COVID, I've come across three groups of patients. One group, they're kind of like the group that's got what I call sedentary type injuries. Now they're sitting more, they're on the couch more, they're working at the desk or kitchen table more, or the laptop rather than their desktop. So they're starting to get aches and pains from that because they were doing that at work, but now they're doing it and where they probably might have had a great setup. Now they're in a different environment, having to deal with kids or loved ones, and not really in a really comfortable position. So they're, instead of sitting for maybe 8 hours a day, they're maybe 16 hours a day because they're home the whole day, right? And then you have the second group, which are folks who are looking at this COVID situation as a opportunity to get back into shape. So they're starting to do new exercises or exercises they're not used to, and they're developing injuries they never had because they're working body parts and joints they never really done prior. And then the third group are folks that are highly dependent on exercise for their joint health, but they're not able to do the things or like physical therapy or home exercises that they normally do to keep their joints healthy or pain-free, and they're kind of lacking that. So their symptoms are kind of returning. And so those are mainly the typical three groups I'm seeing in my practice.
Which actually that brings me to the point, Erica. People now, when you're at your desk and you're at work, generally over time, people have, been able to have a work site evaluation or have a decent setup of their work site. Now they're doing it on their couch and at their kitchen table and all these different things. So, what are some of the things that you recommend to people that are now doing work at home that weren't used to that might be ergonomically helpful for them?
A great question, and one that I'm getting very frequently. I think one of the biggest things I'm finding is when people are at work, they often have a desk setup, like a desktop. Now people are using laptops from home. And the problem with the laptop is if you're sitting with it on your lap, you're looking down at it. Or if you have it on your kitchen table, you're looking down on it. Ideally, we want a screen to be at about eye level. So the top of the screen should be hitting you right about here. With a laptop, that's not happening. So what I've been recommending for a lot of people is get a book, get a ream of paper, put your laptop on top of it. And then you can go onto any website and order an external keyboard that you can put now at the height of the kitchen table. So your keyboard is in a better position, the laptop screen is in a better position, and this might help considerably with people's neck and back pain. The other option too is I have people who are sitting in bed, sitting on the couch, again, laptop or computers on their lap, you can get a little tray, like a little tray that comes across that has legs, and you could put your laptop on that and that'll raise it up. So the idea is just try to get the screen up a little bit higher to you, and that should help with pain.
Yeah, that's great. Back in the day, we used to use telephone books, but I don't think those telephone books exist anymore.
Maybe somewhere deep in the basement, you can find some.
So what are some of the activities and movements and recommendations that you might give, Erica, for somebody just in general when they're at home?
Sure. So I think a lot of the injuries that I'm seeing, just like Dr. Cyril was saying, is a lot of things involving the neck and back and people just being stiff from sitting in bad postures all day long. So one of the things that people can do that's really basic is just do shoulder rolls, pulling their shoulders back, trying to open up their chest and improve their posture. Another thing that I give people to do is chin tucks, which is just basically pulling your chin back and putting your ears over your shoulders. So I tell people do 10 repetitions. Another really easy thing to do is stand up. So people get lost in their work. 3 hours later, suddenly they've been sitting down. If people can set a little timer on their cell phone for every 30 minutes, you don't have to do a lot. Just stand up, stretch, reach your arms up overhead, sit back down. That can make a big difference as well.
George, I was going to ask you that a lot of people are really concerned about their joint health. I mean, that's really a big thing. They've got arthritis, whether it's their hip or their knee in particular, but it can be any joints. Are there certain activities and movements that are damaging those joints that they should kind of make sure they avoid? And are there really certain ones that may be more beneficial? I think I'm going to ask both of you that same question. If you can start with that, George.
Yeah, so what I typically tell patients is if you have joint pain and you have a certain activity that causes pain, you may want to avoid it. So and that typically, is if you are a runner and you're having knee pain, and every time you run, for 5 minutes it causes pain, you want to probably back off the running. If sitting or makes you feel better and you want to rest, or stretching typically is a motion that a lot of people like, that's something you probably want to harp on until you kind of recover from the joint pain.
Eric, anything you would add to that?
Sure. So for joint pain or joint health, I often recommend low to medium impact activities. So, if something hurts, obviously we want to avoid it, but just getting out and going for a walk each day, that can be beneficial. If people, it's the summertime, if people have pools or can get to one, getting in the pool is a great thing. Also, I tend to find that strengthening your joints and stretching them is very beneficial because your muscles are what provide the support to the joint. So if you have any exercises like getting up and down from a chair or stretching your calf, if that stuff makes you feel better, I encourage people to continue those activities. And the same thing, if something hurts, your body's telling you something. So don't continue to try to force through it, back off from those exercises.
Yeah, and that's, I think, like the next iteration. Those are great things to do to kind of keep the joints moving and healthy. Now what happens, and start with you, Erica, what do you do as kind of some self-management strategies? Now my knees have been bad and they're kind of getting worse because I've been sitting all day long or whatever. Besides getting up and moving around, are there things that I can do at home without needing to go to a doctor that I can try to manage it on my own first?
Sure. So one of the biggest things is when you're sitting for a prolonged period of time or immobilized, your joints will get stiff. A lot of people tell me, particularly with knee or hip pain, they sit for a while, they stand up, it's uncomfortable. So just gently going through what we call active range of motion. So if your knee feels stiff, just simply bending and extending it a few times back and forth. Same could be true for your ankle, same for your hip, shoulders, name the joint. So instead of keeping things immobilized, just work on moving them. And you don't have to do a lot, do like 20 repetitions at a time, but that will help, again, provide lubrication and flexibility in the joint. So that's a simple, easy thing that you can do on your own at home.
George, medications, things that you would consider, if you're home and it's starting to really get bad, or modalities, anything that we could do to help out?
Yeah, so before we get into medications, I like patients to try to ice, or if it's you have that achy, toothache type pain in your joint, ice can really kind of calm things down, reduce the inflammation. Sometimes folks will do like a Epsom salt bath that can help a little bit. Sometimes heat, if ice doesn't hurt, if ice is bothersome, they could try heat, and maybe finish up with ice again. Then, there are over-the-counter medications you could try, like anti-inflammatories, like ibuprofen or naproxen, but I don't recommend using those, consistently. If if it's been a week or so and you've been taking those medications, you probably want to talk to your doctor, because those things could have, long-term side effects, and you want to probably get a diagnosis before you continue self-treating.
The question of ice or heat, everybody asks that all the time. How do you decide? Where do I start?
Yeah, so I generally tell patients, if it's really joint pain, typically ice, is probably the best go-to. I find that heat works best with muscle type joint pain, but some individuals do find heat satisfactory. So I would say go with ice first, but if that doesn't work, try the heat.
Erica, how much ice, how much heat? Do you use frozen peas? What do you use at home?
Anything works. The frozen peas are great because they mold to the body shape. So I definitely agree. What I tend to find is also I look at symptoms. So if people are describing that they feel stiff, they feel tight, I might go more towards heat, especially on the muscles. If somebody feels swollen, inflamed, I recommend ice more. It also depends on the length of the injury. So if you hurt yourself and sprained your ankle 3 days ago, frozen peas are the best thing for it. If you've had stiffness in your back for 6 years, then using heat can be okay. So sometimes I just have people try both options. I always like to start with ice. That always tends to be a great place. And then if that doesn't work, then try the heat. But also, like I said, I base it on symptoms. And then in terms of also length of time, 10 to 20 minutes. Sometimes people will keep ice on their knee for an hour. There's no need for that. 20 minutes would be the maximum.
Got it. So George, if I'm home and my joints are hurting and I've done all the things you guys have told me about here, and when is it that I should start to worry a little bit, and when is it I should call my doctor and be seen in some way, shape, or form? And we'll talk about that in a little bit, whether it's in person or telehealth or whatever. But when do I have to start worrying a little bit?
Yeah, I typically tell patients that if your quality of life is being disturbed by this pain, you should probably see a doctor about that, because that means it's pretty significant. If it's like a mild ache and pain or dull ache that's not reading anywhere and you could still function and you don't really think about it when you're going your day-to-day activities, then you may want to wait it out a little bit. But if it's occurring every time you let's say it's your knee, you walk, or every time you sit, is pretty consistent and not really going away with a lot of things we just discussed, then you probably want to talk to your doctor about it.
Got it. So to both of you, is it okay to do high impact activity if you have joint problems? Because people ask that all the time. How much is okay? Is it okay? What's the effect of doing high impact stuff if I have joint issues? Good, bad, indifferent. That's the question.
It's a double-edged sword.
Yeah.
So I'll take a stab at it first.
Sure.
So I like to tell people, I'm in the business of getting them back to what they love to do, not to make them stop. So people who have joint pain, it's very interesting because you can see people with different levels of arthritis or joint damage, and they're at very different levels of function. So I base it on what the person can do. If the person wants to get back to, say, jogging, we'll make sure that they're very strong, their balance is good, and that they have the mobility to be able to do that activity. If they started and they feel good and things are going okay, then I let them continue. If the more that they do an impact activity, such as running, if it hurts more and more and more, even though they're strong, even though they're flexible, then that's their body, in my opinion, telling them maybe this is not the best activity for you. So I guess the answer to your question is it really depends. And I'm sure that you both can speak to this in your practice. I've seen people who are marathon runners, have run, 20 plus miles a week for their whole life. They have no knee arthritis. I see people who have been sedentary their whole lives and they have knee arthritis. So it's really individual.
Yeah, I totally 100% agree. We have to find a balance, and we talk about high impact and what long-term effects that could have on someone. But if you can do it comfortably and doesn't take you out for the next 2 days afterwards, then it might be okay. But if you're, let's say it's long distance running or jumping out of an airplane, and every time you do it, it's killing you, then it's probably a bad idea. You should probably sit on the bench a little bit and recover.
Very good. So obviously with the last 3 months, the world's changed a lot. And I think the way we deliver care has changed a lot. Tell me how your practices have changed in the COVID, and I'm not going to say post-COVID yet because we're not really through it yet, but we're hopefully, at least in New York City here, we're on the downside and have done a good job with it. But tell me a little bit, George, you start about what's your practice like now in terms of seeing patients in person, telehealth? How is that done? Is that working? Is it not working?
Well, surprisingly, it's working pretty well. Patients are satisfied, they're happy. And what I've kind of done is allowed patients to choose whether they want to come and see me in person or do a telehealth just like we're doing with right now on Zoom. And those who, just based on their personal preference as far as safety concerns. And through the video, you could get a lot of information. As the patients could kind of help me out with the physical exam. I get the same amount of history that I would in person, and I could give them the plan. And everything's now paperless, so we get the prescriptions out to them right away, the same way like we would do in the office. Now, if someone had something more concerning and I could catch it on the video, then I bring them in, I do a hands-on physical exam and get a more clarity on what's happening, and that helps a lot. And I think, we talk about this new normal. I think a lot of the patients who are, who are averse to coming into the doctor's office, for various reasons, parking, the hassle of traffic, and just being, it's a long list of things. They like seeing a doctor in the comfort of their own home with a family member. So I think that's been a plus.
That's great. Erica, how about your practice?
So same thing. I'm seeing patients both in person and via telehealth. I think that it depends on the person's comfort. But what I do like about the telehealth option is that I can actually see people in their own environment. So it's one thing where a patient comes to you and says, hey, listen, I have this chair I sit in and it's just so uncomfortable, and you're trying to picture it. Whereas if I can actually see their setup, I'm able to better problem solve with them. So I've really appreciated that. And the same thing, if I'm doing an examination and I feel like something needs to be escalated, I do have the person come in and see me in person. I think the telehealth too has been nice because there's no interruptions. We're focusing on you, and people seem to really be enjoying it. Actually, in the rehab department, we've been looking at patient satisfaction scores, and people are incredibly happy with it.
Yeah, it is very interesting, because I think it was one of the therapists at HSS that I was talking to that said they realized somebody they had been seeing beforehand. When they saw them virtually, they watched them at their own home, and all the things that they were supposed to be doing when you actually could see them when they were supposed to be doing it at home, they weren't doing it anywhere near like that they learned so much about. They weren't giving them the right cues that they actually needed, so that there was actually almost this advantage of using it. And I think, like both of you have said, a lot of it is being done in combination, using some, maybe starting off by seeing them in person and getting a good sense of them, and then following up at home, and then maybe a follow-up at somewhere down the road, then in person again.
Yeah, to add to that, I've been doing that a lot. Sometimes I'll have somebody come in, on a Monday in person and then a Friday via telehealth. And it's nice too, because we can divide up what we're doing and really see what's best for the person.
Yeah. George, how would you want somebody to prepare if they were going to come in to have a telehealth visit with you? Is there anything in particular, advice you would give them, or something you'd want them to do? Obviously, getting the paperwork done ahead of time really makes a big difference, so you're not, sitting anywhere. But what would you recommend? Is there anything in particular?
I would say prepare almost like you're coming to see the doctor. Wear comfortable clothes. If you have a lower extremity problem, wear some shorts, and have a little bit of space in your house so that I can see you walk around, see you do a couple exercise movements, and just make sure you have a place to put your computer or your laptop or your phone so that I can see you clearly.
Anything different, Erica, that you guys do with the visits?
So one of the things I find is that people have trouble propping the computer or the cell phone, and it tends to fall down a lot. So consider ahead of time where your setup is, and have it somewhere where you can put your iPad or your cell phone up, and it will stay in place so that you can step away from it and we can watch your movement. That's one thing. The other thing from a physical therapy standpoint is have a yoga mat or a towel that you can lay out on the ground ready to go, because a lot of the examination that we do does involve having you lay down. And the last thing I would recommend is we tend to test people's strengths. So if you have an upper extremity injury, have a water ball or something that you can hold so that we can see how you can move and lift it. And then I agree, wearing comfortable clothes where we can expose the body part that we're looking at is always beneficial as well.
Yeah, I think it's funny what you said about the phone is always falling down. When we were making videos to make some online educational stuff for people of what they could do at home, the first thing I did is I finally bought a stand. And it was like life-changing, because I could actually put the stand in there and put my little phone on there. And all of a sudden, I didn't have to put it up against a book, and it was falling all the time, and I had to redo it and everything. So that was probably one of the simplest things, if you can get it positioned just right, too.
Yeah.
So are you both seeing patients in virtually and in person now? Things are in person. Anything new that you're doing when you're seeing people in person post-COVID, for patients to understand about, how safe is it for me to come out? Go ahead,
yeah,
John.
So in person, we're taking very high precautions and safety measures to make sure that people are protected, the hospital employees, the doctors are protected, and also the community. So when someone gets called to come in, they're being screened over the phone. When they enter the building, they're getting their temperature taken. And everyone in the hospital, including the patients, are wearing proper PPE to protect their eyes. They're on the mask. Yeah, it's been a pretty safe and smooth process. We've also limited the amount of visits so that you don't have a crowded waiting room. We don't have crowded elevators. And in exam rooms, no more than 2-3 people. So we're continuing the 6-foot separation or distancing in and out of the hospital.
Yeah, it's actually amazing. Go ahead, Erica, please.
I was just going to say we're following the same protocols in rehab, following social distancing, making sure that the therapist is only working with one patient at a time, and following universal precautions, washing our hands thoroughly. We have Purell everywhere. And I think that people have felt very comfortable coming into the hospital. I think they've been impressed with all the steps that we've been taking for their safety and for all the safety of our staff.
Yeah, it is
one
really
thing I forgot
been
to
over the
add,
last
sorry.
week.
Between the exam rooms, we also are cleaning them. So it's you're in, out, clean, next patient in. So that was something that's new that wasn't doing before.
Yeah, it's been really amazing over the last week and a half, the transition going from 1 day a week of clinic to now everybody's kind of back into the regular offices. The spacing has been way better than I imagined. The time frames, the people getting in and out. You walk in the waiting room, there's nobody there because they have the seats spread apart and everything too. So I think everybody and the patients seem to be great about it too. I mean, they kind of understand, and I think they're able to move in and out very quickly. We have a lot of the staff that are remote also too. Okay, I don't know if we have any questions coming from the thing. I'm looking up here as we kind of conclude here in a minute. Just to kind of wrap things up a little bit, and then we'll see if there's questions that pop up as we're talking. Maybe there's one in the chat here. Let me check this out. Let's see. Oh, here's a question. George, you want to take this? Can you explain the difference between non-steroidal anti-inflammatory medications?
Okay, so the difference between, so first of all, non-steroidal anti-inflammatory medications are medications used to combat inflammation. Now, there are different types over the counter. Ibuprofen and Aleve are the two popular ones. And some people, I guess, mistakenly call, not like the people, patients, Tylenol as an anti-inflammatory, and that's not an anti-inflammatory. That's more of a pain medication or analgesic, we call it. The difference between the two really is the time they act. So let's say a tablet of ibuprofen has 200 milligrams. That may last maybe 2 hours, whereas a tablet of Aleve might last 8 hours. So it's more of a length thing as far as the difference, as just to simplify it a little bit. Obviously, there are two different types of their chemistry is a little different, but they tend to do the same thing. Some folks will think that Aleve is a little bit safer, let's say on the kidneys and on the stomach, but essentially they all do the same thing, just that we prescribe these based on risk and patient's effectiveness.
Great. Another great question here. For Erica, you can start with this. Pain has impeded my sleep schedule. What do you suggest to alleviate it?
Great. So for some reason, pain tends to crop up at night, especially when people are sleeping. One of the things I recommend is, we spoke about heat and ice before. So finding out which one feels best for you. And then I tell people to put heat or ice on the body part that's giving them trouble about 10 minutes before bedtime. That can help. Also, sometimes, just heating the joints, so taking a shower before bed or getting in a bath with Epsom salt, which was suggested before, that can help. Another thing is, if you do stretches and you do them during the daytime, doing them at nighttime also can help. I tend to find that joints, especially arthritic joints, they don't like to be immobilized. So the more you can kind of warm them up and get them loose before you go to bed, that can help you sleep better through the night. Okay. Anyone else have any other suggestions? I think that's one of the most common questions we get as practitioners.
Another thing I also add was, I always tell patients, make sure you have a bed that's comfortable. And sometimes patients will say, every morning I wake up in pain. What's going on, doc? Well, what were you doing before you woke up? I was sleeping. Well, it's probably your bed, and you gotta make sure you have a bed that has good support, and that actually will help with reducing joint pain.
Okay, another question here. Are topical medical marijuana options helpful with severe low back pain, arthritis, and scoliosis?
So when it comes to these topical medications, whether it be marijuana or prescription, medications, I mean, just remember these things do not travel through the skin and go into your joint. So what typically what may happen might be distracting your brain from, or giving your brain another sensation to feel instead of the actual joint pain. So would it be effective? It may be effective for those reasons, but would it cause significant improvement? There's a lot of mixed information out there, and I'm not, quite certain if that's an effective way of treating joint pain.
But we are all still at home probably a lot more than we used to be. And I think what you've heard from our two experts today is obviously the more we can continue to move and not get stuck in that one place for too long will help a lot. And I think, as Erica really emphasized a lot too, just the positioning of the computer. If there's one thing people can do, if we can just get it so that we're not looking down on it so much. And I think the second thing is just stop sitting so much. Even if it's like every 5 or 10 minutes, get up and walk around, maybe 5 every 15 minutes, walk around the desk once, just do something to kind of unload a little bit, it'll help. So that's, hey, one more question. They snuck it in. Let's see. Nope, that was the same one.
Can I add one other thought, Dr. Press? I just
sure.
about this.
You get the last one.
Not only is the computer forcing people to look down, but you know what's the biggest culprit? The cell phones. So not only bring your computer up, but if you're, going online, checking your Instagram account all day long, don't hold it in your lap. Bring it up to your face, okay? You just reminded me of that.
And I am guessing that almost everybody on Earth is using their cell phone more over the last 3 months than they have, and their, plans for minutes has gone way up too.
Yeah.
So that's all the time we have for today. I want to thank you again for tuning in. And if you have any other questions or would like to learn more about HSS, please visit us at hss.edu. Thank you all for coming.
Thank you. Bye-bye.